So now we're going to discuss the systematic approach to analyzing these sorts of cardiovascular effects of autonomic drugs and also other drugs. So what I have written down here is the approach that you want to take in the proper order, and then we'll go into a little bit more depth about each one. So when you're faced with a question, and over here this is the beginnings of a question where in this case we're just looking at, here's an agonist, and we usually refer to agonist as drug X, okay? It means it's stimulating a receptor, for example. We saw that we had the control, blood pressure and heart rate, red for blood pressure and yellow here for heart rate. And now when we add this agonist, you can see that there's some changes that are occurring, okay, to the blood pressure and also the heart rate. And also notice that these changes go back to baseline because agonist effects in these experiments, we consider them to be short-lived. As we start to go further along, we'll start to add in antagonists and try the agonist again, but we'll just start with just a singular agonist here. Now, what we have for the systematic approach would be to look at the changes in the diastolic blood pressure. So what that would mean is right here, you can see that that would be the first step. Now, what would normally happen here is there'd be options of things that the agonist could be, drug that the agonist could be. So there would be a list of, maybe 4 or 5 or 6 different drug possibilities. Now what you would do in that case is after you look at the changes in the diastolic blood pressure, you don't look at anything else. You actually go and you start to eliminate possibilities, right? So of those options that would be there, which ones would you expect to not increase the diastolic blood pressure? And then you cross them out. In a way, you're kind of thinking of this as a diagnostic test, right? You have some hypotheses. The hypotheses would be given to you, and then you use this singular test to figure out what can you rule in and what can you rule out. So in some cases, the diastolic blood pressure can get rid of maybe half of the choices, okay? So that's what you want to do, is you want to stop after this test result and go and eliminate possibilities. Now, if there's going to be still some drugs left, which there likely are going to be, then you go on to the second step, which is you're looking for changes in the pulse pressure. So what that would mean is you'd have to draw this in, right? So remember, you can draw in the pulse pressure very easily. Remember over here on the Wiggers diagram, that's the difference between the systolic and diastolic pressure. And what we notice, right, we can number this number 2, is that the pulse pressure is going up, okay, in this example. So then what you would do is you would stop. You already have eliminated some possibilities, hopefully, from your first test. Now you have your second test, the pulse pressure. Now you can further eliminate some options and keep others in. Now in this case, this might be enough, possibly, to identify correctly the drug of the options that are given to you. Okay, now let's assume that you want to have a deeper understanding still. You want to really feel like you understand everything that's going on. You can go all the way to steps 3 and 4. And as we're going to see, it's going to be important to look at steps 3 and 4 when you have more complicated drug tracings to analyze, where you have agonists and antagonists and agonists again. But in this example, let's take a look. So the changes in mean arterial pressure are kind of expected, right? Because if the systolic pressure and the diastolic pressure are going up, of course the mean arterial pressure is going up, because remember, the diastolic pressure plus 1/3 of the pulse pressure is the mean arterial pressure. So the map is going up, okay? Now, based off of that, so this would be number 3, okay? Based off of that, we would expect there to be a baroreceptor reflex elicited that would result in an increase in parasympathetic tone and a decrease in sympathetic tone. And we're going to go in additional videos, going to explain that a little bit more. But this is going to be taken into consideration the baroreceptor mediated effects on the SA node, which affects the heart rate. So this would be what we refer to as an indirect effect. Okay? And the bigger the change in the map, increase or decrease, the bigger the magnitude of that baroreceptor reflex is going to be. Now, finally, we see the heart rate. Now, notice we're doing that last, and the reason why we're doing it last is because we can't just look at the heart rate from the perspective of what the drug would directly be doing, because some of the drugs that we might be seeing are going to have a direct effect on the SA node, right, the pacemaker that regulates the heart rate. So what we want to do is we want to look at the heart rate last because we've analyzed the blood pressure, and now we're going to take that into consideration when we're looking at what the net effect on the heart rate is. So when we're looking at changes in the heart rate, right, which in this case would be decreasing, we're going to take our knowledge of what happened to the map. So we expect that the heart rate would go down, right, from just the map changes here. But what if the drug was doing something that would directly stimulate the SA node, and we would expect the heart rate to go up? Okay, well, the data here shows us that the heart rate's still going down. So even if the drug was doing something directly to the SA node, the data tells us that when you take these two things into consideration, the baroreceptor reflex response is going to be the winner. And in most cases, that is what happens, but you kind of have to think about what the data is and what the drug considerations are and work through it in a very systematic and thoughtful way to really understand why these changes are happening. But that would be generally the steps that you would take to try to figure out what an identity of a drug is. Now, I don't have in this example yet what those drug options are. We're going to be addressing that in later videos. I just wanted to give you first the framework, the stepwise approach to analyzing the changes in the blood pressure and heart rate. And once you have that stepwise approach, you then can start to build in the physiology that can explain why these changes are occurring. And that's what we're going to do next.